Welcome to UMass Memorial Medical Center's Kidney Transplant Program. We have prepared a short video to introduce you to our transplant program. We will be covering many topics, including general information about kidneys and kidney disease, the transplant evaluation, getting on the wait list, types of donors, and how to take care of your new kidney. You should feel confident that your transplant team will help you along the way. We look forward to working with you to begin your transplant evaluation. First, let's briefly talk about your kidneys. Most people are born with 2 kidneys that perform several vital functions, such as maintaining a healthy balance of water, salt, and minerals in your blood. Your kidneys also regulate your blood pressure, filter your blood, and filter waste materials out of the body through the urine. Healthy kidneys promote strong bones and help make red blood cells to prevent anemia. When you think about it, your kidneys play a major role in keeping you in good health. A number of illnesses can lead to kidney disease, but diabetes and high blood pressure are the most common. Heart disease, obesity, smoking, family history, and advanced age can also lead to kidney disease. When your kidneys are failing, you have choices of treatment options such as peritoneal dialysis, hemodialysis, transplant, or no treatment. We recommend kidney transplant as the best option to treat your kidney failure. Let's talk about the benefits of having a kidney transplant. After your transplant, you will no longer need dialysis and will feel better because you have closer to normal kidney function. A new kidney can give you a better quality of life and lower your risk of having a heart attack or stroke in the future. Once you recover from your transplant surgery, you may have more energy, a better appetite, and be able to be a more active person. Next, let's talk about your transplant evaluation. Since a kidney transplant is a major operation, you will need to go through a thorough evaluation. This is how our team decides if a kidney transplant is right for you. Every transplant center has their own rules for who may be considered a candidate for transplant. You must either be approaching the need for dialysis or currently requiring dialysis to be considered for transplant. The next step in your transplant journey will be to meet with your transplant team. You will be scheduled to come to the transplant clinic at UMass Memorial to meet your team. Your pre-transplant coordinator will organize your pre-transplant evaluation up until the time you receive a transplant. You will meet with a surgeon, a kidney transplant nephrologist, a social worker, a dietitian, and an infectious disease specialist. We also have other team members that you will meet during your transplant journey. Every team member will focus on a specific part of your evaluation. Your transplant evaluation will assess your overall physical and mental health. It is important that you have people to help you during the transplant process and that you have stability in your life. Our transplant social worker will meet with you to talk about these issues and more. If indicated, we may have you meet with our transplant psychiatrist. Our transplant dietitian will talk to you about your diet, foods that your body needs to heal, and will provide nutrition advice about maintaining a healthy weight. Our transplant financial coordinator will review your coverage and will work with your insurance company to obtain authorization for your transplant. Let's move on to other testing that you will have as part of your transplant evaluation. Having a transplant is a major life event. Therefore, your transplant evaluation will include blood work such as blood and tissue typing, viral studies, and tests to look at your overall health. These tests are also done on donors to determine their compatibility with you. You will have a chest X-ray, CAT scan, and cardiac stress testing. If you have been a smoker, we may obtain testing to make sure your lungs can withstand surgery. If you do currently smoke, it is a good idea to quit before you have a transplant. Our team may refer you to other specialists to further evaluate other aspects of your health before your transplant. You need to be up to date on routine health maintenance screenings such as your mammogram, pap smear, and colonoscopy. You should also see your dentist on a regular basis prior to your transplant to make sure your teeth are in good health. All of these tests will allow your transplant team to know whether you are a good candidate for transplant. How do you get on the waiting list? Once your evaluation is complete, our Transplant Patient Selection Committee will review your history and test results and will decide if a kidney transplant is right for you. Occasionally, our team may decide that the risk of having a transplant is likely to outweigh the benefits. If this is the case, a person may not be accepted as a transplant candidate. You will always be notified in writing when your status on the transplant waiting list changes for any reason, including being active, inactive, or being removed from the wait list. It is in your best interest to complete your transplant evaluation as soon as possible so that you can be active on the waiting list. What kind of kidney donors are there? A kidney transplant cannot happen without an organ donor. There are two types of donors, living donors and deceased donors. A living donor is someone who is interested in donating one of their kidneys to you. Living kidney donors must be in excellent physical and mental health and will go through an extensive evaluation performed by our living donor team. A living donor kidney may be the best kidney that you could receive, as the outcomes are better in people who receive a kidney from a living donor. A living donor kidney transplant can be done quickly, usually works immediately, and can last longer than a deceased donor kidney. Please consider living donor kidney transplant as your best and quickest option for receiving a transplant. Once you have been accepted as a transplant candidate, people interested in donating to you should call our living donor team at 508-334-1269. Let's talk about another option for living kidney donation. You may have a living donor that would like to donate to you, but they cannot donate to you due to blood or tissue type incompatibility. If this happens, we can enter you and your donor into what is called a kidney paired exchange. This is when two or more transplant candidates have donors that cannot donate directly to them. In this case, the donor organs are exchanged from one pair to the other on the same day. Not everyone has a living donor available to them, so next we will talk about deceased organ donors. If you do not have a living donor, there is the option of deceased donor transplant. A deceased organ donor comes from a person that has died and is donating their organs. This is done through a waiting list run by the United Network of Organ Sharing, also known as UMass. There are many factors UMass uses to determine whom will receive a deceased donor kidney, such as how long you have been waiting, how long you have been on dialysis, and your blood type and tissue match with the donor. Some transplant candidates receive priority on the kidney transplant waiting list. These include children under the age of 18, people who donated an organ to another person in the past, and some people who have had a liver transplant in the past year. Priority is also given to transplant candidates who are hard to match with a donor. Deceased donor kidneys are given a score based on donor characteristics and how the donor died. This score, which is measured from 0 to 100%, is called a Kidney Donor Profile Index, or KDPI. In general, the lower the KDPI score, the better the kidney. As a transplant candidate, you are also given a score when you are added to the transplant waiting list. Your score is called an Estimated Post-transplant Survival Score, or EPTS. This score, which is measured from 0 to 100%, is based on your age, how long you have been on dialysis, whether you have diabetes or not, and whether you have had a transplant in the past. Kidneys that are predicted to last a long time are directed towards transplant candidates that will need a kidney for a long time. Let's talk about other things to keep in mind. All transplant centers in the United States are members of UMass. UMass is the organization contracted by the government to provide all of the organ matching, policies, and administrative work related to organ transplant. UMass Memorial Medical Center is part of Region 1 of UMass. For more information regarding UMass, please visit www.umass.org. What is multiple listing? UMass believes you have a right to be on the transplant waiting list at more than one center if you wish to do so. This is called multiple listing. Multiple listing may improve your chances of getting an organ offer sooner in one part of the country than another. If you wish to be multiple listed, you should check with your insurer to make sure they will cover the costs of being multiple listed. You should also know that every transplant center has their own rules for who and who may not be a transplant candidate. We will provide you with a brochure that discusses multiple listing in more depth if this is something that you wish to explore. There are things you need to remember when you are on the wait list. Please notify your transplant team about any changes in your life or your health. Please let us know if your address or phone numbers change, or if any of your emergency contact numbers change. You should also call us if you or your employer are planning to change your health insurance, or if you lose your health insurance. Please also notify us if you are planning to travel out of the area or if you begin dialysis if you are not already on it. When you are waiting for your transplant, we will see you every 6 to 12 months in the transplant clinic to keep your evaluation up to date. If you are on dialysis, we will also maintain regular contact with your dialysis unit about how you are doing. While you are waiting for your transplant, it is important that you exercise and keep up with your health, such as routine cancer screening and having your teeth cleaned. You should keep your telephone charged and nearby you at all times, and be ready for a call at any time of the day or night. Try to prepare ahead of time by having a plan for how you will get to the hospital, who will drive you, who can take care of your children, pets, or mail, etc. Your body's immune system is very important in the kidney transplant process. Your immune system protects you by recognizing what belongs to you and what does not belong to you. In transplant, your immune system plays a large role in determining which kidney is right for you. An antibody is a protein that the immune system produces when it detects a foreign invader or substance and tries to fight it off. We know that people can develop antibodies from receiving blood transfusions, from receiving an organ transplant, or from having pregnancies. Antibodies are important in kidney transplant because if you have them, it can be more difficult to find a donor that you are compatible with. Once you are active on the transplant waiting list, your transplant coordinator will work with you to have your antibody level checked every month. This is done by blood work that can be drawn either at your local lab or your dialysis unit. This blood is also used at the time of transplant to make sure you are compatible with your donor. Your antibody level is measured in a percentage from 0 to 100%. If your antibody level is 0%, it means that you have not developed any antibodies against the blood of potential donors. The higher your antibody level is, the more difficult it will be to find a compatible kidney for you. If you do have a high antibody level, you will get extra priority on the transplant waiting list to improve your chances of receiving an organ offer. Please keep in mind the importance of having this monthly blood work drawn once you get on the transplant waiting list. Now let's talk about the moment you've been waiting for. When a deceased donor kidney is being offered, a transplant coordinator will call you and ask you questions about your medications, your history, and how you are feeling. This can happen at any time, so please make sure your phone is with you and that you can hear it at all times of the day and night. Transplants often happen at night and on the weekends, so you must be prepared for when the call comes. The transplant coordinator that calls you will give you clear instructions about what to do, where to go, when to go, and what to bring with you to the hospital. Now, let's talk about what happens when you arrive. When you arrive to the hospital, a member of the transplant surgery team will meet with you to discuss the operation and get your consent to operate on you. Your surgeon will discuss the potential risks of surgery with you in detail, which can include bleeding, infection, delayed function, urine leak, blood clot, and recurrence of whatever caused your kidney failure. There is a risk of getting cancer or infection from the donor kidney if these were undetected at the time of the donor evaluation. Once you are in the operating room and put to sleep, an intravenous or IV line and other types of catheters will be put in your body so you can receive medicines and fluids. Our transplant anesthesia team will closely monitor your heart, blood pressure, and many other body functions. A kidney transplant is placed in your lower abdomen near the hip bone. Your own kidneys are not removed at the time of transplant. The donor kidney comes with blood vessels which will be connected to your own blood vessels to supply the kidney with blood flow. Attached to the donor kidney is a ureter, which is how urine flows from the new kidney into your own bladder. The end of the donor ureter is attached to your bladder. The kidney transplant surgery takes about 4 to 6 hours. Once your surgery is completed, you will wake up in the recovery room, which is also called the post-anesthesia care unit. You will stay in the recovery area for several hours. You can then anticipate spending the remainder of your hospital stay on the 7th floor. If you require closer monitoring, you may go to the intensive care unit after your surgery. When you wake up, you will have pain medication being continuously delivered directly into your vein through an IV. You will be changed to pain pills that you will have to ask for in order to control your pain. You will also have a catheter that will drain urine from your bladder into a bag. If the urine is slightly bloody at first, that is not cause for alarm. The color of your urine will gradually look more normal. It is important to get you moving quickly after your surgery in order to prevent complications. Your caregivers will assist you to get out of bed into a chair for your meals and will increase your activity quickly. From the first day of your hospitalization, we will be preparing for your discharge from the hospital. Our goal is to get you out of the hospital quickly and to get you home to recover. Getting a kidney transplant will change your life and your routine. While you are hospitalized, you will meet your new transplant coordinator who will care for you after your transplant. You will be educated by your coordinator, nurses, a pharmacist, and dietitian about your care after transplant. Some basic rules about care after transplant include avoiding people who are sick, maintaining a healthy diet, frequent hand washing, and good communication with your transplant team. Kidney transplant is not a cure for your kidney failure. It is another form of treatment. Therefore, you will always need to be monitored to make sure you and your new kidney are doing well. You will need to have blood work done on a regular basis after your transplant to check the function of your new kidney, to check for side effects of medications, and to make sure you are receiving the correct amount of medication. Right after your transplant, you will have blood work done twice a week. Gradually, the frequency of the blood work is decreased to once a month. In addition to blood work, you should be prepared to come back to the transplant clinic for appointments with your transplant team to check on your progress. The most important thing to remember after your transplant is to take your medications. Before your transplant, you were probably on a variety of medications to manage your kidney disease. Some of your medications will change after transplant and will include a type of medication called immunosuppression. This type of medicine decreases the risk of your body rejecting your new kidney, but only if you take them every day as directed. You will be prescribed these medications for the rest of your life. For a brief time after transplant, you will also need medications to prevent bacterial and viral infections. It is important that you do not start or stop any medications after your transplant without first checking with your transplant team. Your transplant team is always available for any concerns or questions you may have regarding your new routine and medications. Receiving a kidney transplant is a journey that we will take with you and help you to navigate. We will become your care partners in the prevention or treatment of any potential complications of transplant, which can include rejection, recurrence of your kidney disease, infection, cancer, and diabetes. Our entire team is committed to you and will do everything possible to help you overcome any potential hurdles along your transplant journey. Every transplant center must report their outcomes to the Scientific Registry of Transplant Recipients. If you wish to see the outcomes of any transplant center in the United States, you can find them at the SRTR website, which is www.srtr.org. We will provide you with written copies of the kidney transplant outcomes at UMass Memorial Medical Center twice a year until you are transplanted. If you have any questions about UMass Memorial Medical Center's outcomes and SRTR data, please call your transplant coordinator. Our team wants you to have a successful outcome, and we look forward to meeting you and working with you on your transplant journey. Thank you for spending time with us today. Please do not hesitate to contact us with any questions or concerns. Our main number is 508-334-1269. Thank you again, and welcome to Kidney Transplant at UMass Memorial Medical Center.